Hello everyone. Today I'm going to talk about bundle branch block. The two different types are right bundle branch block and left bundle branch block. So, in a normal heart, the sinoatrial node in the right atrium acts as a pacemaker of the heart, generating impulses that spread through the atria and then through the atrioventricular node to the ventricles with a bundle of His that divides into the left and right bundle branches to supply each ventricle, as can be seen in the diagram. With bundle branch block, one of the branches no longer conducts an impulse, as shown for example in this diagram, the left bundle branch, and so the two ventricles do not receive impulses simultaneously, and so in this instance there will be left bundle branch block. Some of the causes for right bundle branch block can be pulmonary embolism, right ventricular hypertrophy, or ischemic heart disease. For left bundle branch block, it can be caused by ischemic heart disease, left ventricular hypertrophy, aortic valve disease, and also following cardiac surgery. On the ECG, what you will see is a widened QRS complex with an abnormal pattern. The pattern to look out for is RSR. Remember, on an ECG, the R wave is a positive deflection in the QRS complex, and an S wave a negative deflection following an R wave. In bundle branch block, within the QRS complex, you see an R wave followed by an S wave, which is normal, but then another R wave, as shown in the diagram. Which ECG lead you see this pattern on determines if it is left or right bundle branch block. In right bundle branch block, you'll see this RSR pattern in the QRS complexes of lead V1. And in left bundle branch block, you'll see the RSR pattern in leads V4 to V6. So, if you see a widened QRS complex with an RSR pattern, look to see which ECG leads are showing the RSR pattern, and you can work out if it is left or right bundle branch block. The RSR pattern resembles the letter M, and so the two words, William MARROW, is a simple way that is used to recognise and remember the abnormal patterns I have talked about and what they represent. William is used to represent left bundle branch block. That is easily remembered by the L's that represent left. The W at the beginning of William reminds you that you will see a W shape at the first leads, V1 and V2, and the M at the end of William to remind you to see the M shape at the final ECG leads, V4 to V6. So you will see something like this, with what almost looks like a W in V1 and an M in lead V6. MARROW represents right bundle branch block. The R is in MARROW to remind you of right, and because M is at the beginning of MARROW, the M is seen in the early chest leads, V1, and the W in the final chest leads, V5 and V6, as shown in this ECG, with what looks like an M in lead V1, the RSR pattern, and then more of a W in V6. So, I've put it all in one slide to summarise William MARROW. So William, you see what looks like a W in leads V1, V2, and then what looks like an M, RSR, in V4 to V6, it's left bundle branch block. And MARROW, if you see the M, RSR pattern in V1, and what looks like a W in V5, V6, then it's right bundle branch block. I hope that was helpful. Thank you.